Good morning, SS1. Sports injuries can happen at any time, on the football field in Kano, the basketball court in Lagos, or the athletics track in Enugu. Knowing how to provide immediate, correct first aid can mean the difference between a minor inconvenience and a permanent disability. In many Nigerian schools and communities, access to hospital care can be delayed. This makes first aid knowledge even more critical. WAEC and NECO regularly test first aid for sports injuries, and every physical education student is expected to know the primary protocols. Today you will learn to identify common sports injuries, apply first aid correctly, and know when to seek medical attention. Sports injuries fall into two broad categories. 1. Acute injuries happen suddenly during activity. Examples: sprains, strains, fractures, lacerations. 2. Chronic injuries, overuse injuries develop gradually from repeated stress. Examples: shin splints, stress fractures, tendinitis. Sprains and strains. Sprain, overstretching or tearing of a ligament, tissue connecting bone to bone. The ankle is the most commonly sprained joint in sport. Signs: pain, swelling, bruising, limited movement. Strain, overstretching or tearing of a muscle or tendon. The hamstring is the most commonly strained muscle in athletes. Signs: sudden sharp pain during activity, swelling, weakness. First aid, RICE method or newer police protocol. RICE. R. Rest, stop activity immediately. Do not walk on a suspected sprain/strain. I. Ice, apply ice pack, wrapped in cloth, never directly on skin, for 15 to 20 minutes every 2 to 3 hours for the first 48 hours. Reduces swelling and pain. C. Compression, wrap the injured area with a compression bandage, not too tight, check circulation below the bandage. E. Elevation, raise the injured limb above the level of the heart to reduce swelling. Newer protocol, police, more current. P. Protection, shield the injured area from further harm. OL, optimal loading, after initial rest, gentle movement is encouraged to promote healing. I. Ice, C. Compression, E. Elevation, same as RICE. Fractures. A fracture is a break or crack in a bone. Types: closed fracture, bone broken but skin intact; open, compound, fracture, broken bone pierces the skin, very serious. Signs: severe pain, swelling, deformity, inability to move the affected area, possible sound of crack at injury. First aid for fractures. 1. Do not attempt to straighten or reset the bone. 2. Immobilize the injury, apply a splint, any rigid material, stick, rolled newspaper, PE kit, along the injured limb, extending beyond the joints above and below the fracture. Secure with bandages. 3. For open fracture, cover the wound with a sterile dressing, do not push the bone back in. 4. Treat for shock, see below. 5. Transport to hospital urgently. Dislocations. When a bone is forced out of its joint socket. Most common in shoulder, finger, and knee. Signs: visible deformity, severe pain, inability to move the joint. First aid: do not attempt to relocate the joint. Immobilize in the position found. Apply ice. Transport to hospital immediately. Lacerations and bleeding. Apply direct pressure with a clean cloth or bandage. Elevate the injured area if possible. If bleeding does not stop in 10 minutes, seek medical attention. Do not use a tourniquet except in life-threatening arterial bleeding, and only as a last resort. These are the most serious and potentially life-threatening sports emergencies. Concussion. A brain injury caused by a blow to the head or violent shaking. Common in football, boxing, and contact sports. Signs: confusion or disorientation, headache, nausea or vomiting, dizziness, memory loss, loss of consciousness. First aid: remove the athlete from play immediately. Do not allow them to return to play on the same day. Keep them calm and still. If loss of consciousness occurs, place in the recovery position. Seek medical attention immediately. Rule: when in doubt, sit them out. Returning to play after concussion before full recovery risks second impact syndrome, potentially fatal. Heat exhaustion. Caused by excessive sweating and dehydration during exercise in hot weather. Common in Nigerian outdoor sports during the dry season. Signs: heavy sweating, pale and clammy skin, weakness and fatigue, nausea, headache, muscle cramps, normal or slightly elevated body temperature. First aid: move to a cool place, shade. Remove excess clothing. Give cool water or sports drink if conscious. Fan the athlete. Rest. Heat stroke, medical emergency. More severe, the body's cooling mechanism fails. Body temperature rises dangerously, above 40 degrees Celsius. Signs: hot, red, dry skin, not sweating, very high body temperature, confusion, rapid pulse, loss of consciousness. First aid: call for emergency medical help immediately. Move to cool area. Cool the body rapidly, apply cold wet cloths, ice packs to neck, groin, and armpits, or submerge in cool water. Do not give fluids to an unconscious person. Cardiac arrest. The heart stops beating. Rare in young athletes but can occur due to undetected heart conditions. Signs: sudden collapse, no pulse, no breathing, unconscious. First aid: cardiopulmonary resuscitation, CPR. 1. Call for emergency help or send someone to call. 2. Begin chest compressions, place heel of hand on center of chest, other hand on top. Push down firmly and fast, 100 to 120 compressions per minute, 5 to 6 centimeters depth. 3. Rescue breaths, if trained 30 compressions to 2 rescue breaths. Tilt head back, lift chin, pinch nose, seal mouth, give 1 second breath. 4. Continue CPR until emergency services arrive or the person shows signs of life. 5. Use an automated external defibrillator (AED) if available. Shock in a medical context is a life-threatening condition where the body's organs are not receiving enough blood flow. Signs of shock: pale, cold, clammy skin, rapid weak pulse, rapid shallow breathing, confusion, anxiety. First aid for shock. 1. Lay the casualty down. Raise their legs above heart level unless head, chest, or leg injury prevents this. 2. Keep them warm with a blanket, but do not overheat. 3. Do not give food or drink. 4. Monitor breathing and pulse. 5. Call for emergency medical help. 6. Talk calmly to keep them conscious. General first aid principles, dear ABC. D. Danger: check for danger to yourself and the casualty. Do not become a second casualty. A. Response: check if the casualty is conscious. Call their name and tap shoulders. A. Airway: open the airway, tilt the head back, lift the chin. B. Breathing: check for breathing, look, listen, feel. C. Circulation: check for pulse. Begin CPR if no pulse. WAEC examination questions on first aid for sports injuries. Question 1. What does RICE stand for and when is it used? Answer: RICE stands for rest, ice, compression, and elevation. It is the standard immediate first aid protocol for soft tissue injuries such as sprains, ligament overstretching, and strains, muscle or tendon overstretching. Rest stops further damage, ice reduces swelling and pain, compression limits swelling, elevation reduces blood flow to the injured area and minimizes bruising. Question 2. Differentiate between a sprain and a strain. Answer: a sprain is an injury to a ligament, the tissue connecting bone to bone, caused by overstretching or tearing. The ankle is the most commonly sprained joint. A strain is an injury to a muscle or tendon, the tissue connecting muscle to bone, caused by overstretching or tearing. The hamstring is the most commonly strained muscle. Both cause pain and swelling, but a sprain occurs at a joint and a strain in a muscle belly or at the muscle tendon junction. Question 3. Describe the first aid management of heat exhaustion. Answer. Move the athlete immediately to a cool, shaded area. Remove any excess clothing. Have the athlete lie down and rest. Give cool water or a sports drink if they are conscious and able to swallow. Fan the athlete and apply cool, damp cloths to the skin. Monitor their condition. If symptoms do not improve within 30 minutes or worsen to heat stroke, hot dry skin, confusion, loss of consciousness, seek emergency medical attention immediately. Question 4. What is concussion and what should a first aider do? Answer. Concussion is a traumatic brain injury caused by a blow to the head or violent shaking, disrupting normal brain function. Signs include confusion, headache, dizziness, nausea, memory loss, and possible loss of consciousness. First aid. Remove the athlete from play immediately and do not allow return to play the same day. Keep them calm and still. If unconscious, place in the recovery position. Seek medical attention. The rule is, when in doubt, sit them out. Question 5. Outline the steps of CPR, cardiopulmonary resuscitation. Answer. 1. Ensure the scene is safe and call for emergency medical help. 2. Lay the casualty on their back on a firm surface. 3. Begin chest compressions. Place the heel of one hand on the center of the chest, cover with the other hand, push down 5 to 6 centimeters at a rate of 100 to 120 compressions per minute. 4. After 30 compressions, give 2 rescue breaths, tilt the head back, lift the chin, pinch the nose, seal your mouth over theirs, and breathe in for 1 second. 5. Continue the 30-to-2 ratio until emergency services arrive or the person recovers. First aid saves lives. Knowing rise for sprains, the recovery position for unconscious casualties, and CPR for cardiac arrest are skills every Nigerian student should have. Encourage your family and community to learn first aid as well. Powered by Lightech Academy, academy.lightech.com.ng. NERDC-approved SS1 Physical Education.